Why are you here today visiting Royal North Shore and Sydney Vital?
So I got a grant from the Australia Harvard Foundation, and they supported my trip to Australia. I was at the EPSM, that's a medical physics meeting in Perth 2 weeks ago, and then I spent a week in Perth working with physicists there. And since Saturday I've been here in Sydney, and I'll stay here for another 10 days. So I'm essentially trying to establish and further develop collaborations between our center and centers here in Australia.
And what's the purpose in general of these exchange grants?
It's fostering exchange between Harvard faculty and faculty in Australia to support Australians coming to Harvard and working there for some time. Yasser is a good example. He's spent a few months or something like that there. And then people like me going to Australia for about a month and just fostering and supporting the exchange between the countries and Harvard University.
Okay. You've been treating cancer with radiation for a long time, and you know a lot about this. I've only recently started, in effect, with the explosion of these peptide-based radionuclide therapies, and we realise that we don't know very much about the biology. What's your view at the moment about the biology, or the differences between external beam treatments and slowly decaying beta particles in a radionuclide? Are these very different things, or are they similar? What do you think?
They are different, and there's some hope that we can sort of exploit some synergistic effects. But we really don't know much about radiation biology. So I'm a physicist by training, and I've worked on sort of better dose localization and new technologies to treat cancer patients better. But the next breakthrough probably has to come not only from physics and technology, but also from better understanding of biology. And that includes like the different mechanisms of interaction of the different types of radiation with cancer. It includes also the dynamics, as we discussed in my lecture, so very fast delivery of radiation using flash, for example, has a different biological effect than slower treatments. So we are just really beginning to understand some of these phenomena.
Yes, we're seeing this with, I say we don't know very much about the beta particles and how they're working, but more so even about the alpha particles and the dramatic responses that people are seeing there. And we don't understand all the dangers yet either of using such a toxic treatment. But it's certainly somewhere where we want to, and Sydney Vital is doing quite a bit to understand a little bit more about the radiobiology of this. So I think it's a very important topic at the moment. Finally, I guess, tell me about the interaction between radiation and the immune system and immunotherapy. Where do you see that going?
There's enormous potential there, and especially with more targeted radiation such as proton therapy, which I'm interested in. So you now can spare areas that are important to develop the immune response that you want and avoid the negative effects of the immune system, right? So and to shape the dose according to those known or not so well known immunotherapy principles is feasible technically, but again I think that there is a bit of gap and lack of understanding and understanding the basics of how the immune system responds to the radiation. So we need to do more work in that area.
It's a difficult problem, isn't it? Because you can't use cells in the laboratory. You can't use immunocompromised rodents. So you really start to limit the platforms in which you can explore this.
So one thing that we are doing in our department is, my colleague Clemens Grasberger is leading this effort, is to model mathematically what we know about agents, and sort of fit some models that where we believe how this mechanism works, fit that to clinical data that we have, and try to optimize it based on that. But you're absolutely right. It's hard to get solid underlying fundamental data for that.
Thank you very much.
Thank you. It was great.